Now let's talk about the San Francisco and Boston syncope rules. By the end of this video, you should be able to recall the criteria used in the San Francisco and Boston syncope rules, and to apply the rules to determine whether a patient meets the criteria. We just talked about evaluating a patient with syncope in the emergency department, and we said that we didn't necessarily need to diagnose the patient in the ED. If we can diagnose the patient, great. We can treat and dispo the patient appropriately for that diagnosis. But for syncope that is undifferentiated, we need to know whether to admit the patient, and to help us answer that question, we have a couple of decision rules at our disposal. There are two rules that you should know about as a rotator in the ED. The San Francisco rule and the Boston rule, named for the respective cities where they were developed. Let's talk about San Francisco first. The San Francisco rule has 5 criteria that you can remember using the mnemonic CHESS. C is for congestive heart failure, a patient with any history of CHF. H is for hematocrit less than 30. E is for an EKG that is abnormal, as in any non-sinus rhythm or any new EKG changes. S is for shortness of breath, and the other S is for systolic blood pressure less than 90 at triage. The rule suggests that if any of these criteria are positive, the patient may need to be admitted because she is high risk. If all the criteria are negative, then the patient is in the low risk category, and you can feel okay about discharging her. That's the San Francisco rule. We'll talk more about the studies behind this rule in a little bit. Next, the Boston rule. The Boston rule has a few more criteria, 8 total, and they can be remembered using the mnemonic bad heart. B is for brain event, or a primary CNS event. A is for abnormal vital signs. D is for depletion of volume. H is for heart attack, or ACS. E is for electrical conduction abnormality. A is for aortic, pulmonic, tricuspid, or mitral disease, in other words, valvular disease. R is for relative with sudden death. And T is for terrible ticker, or any worrisome cardiac disease. Bad heart. So that's a lot of criteria to remember, but before you get overwhelmed, remember that our big question is, do I admit? And that to answer that, we ask another question. Is it cardiac? Take a look at how many of these criteria are directly trying to answer that question. The Boston rules state that if any of the criteria are met, you should consider admitting the patient. If all the criteria are negative, you can feel comfortable discharging her. Let's take another minute to go into a little bit more detail about some of these criteria. Here is the actual table from the study listing the criteria. Brain events are pretty self-explanatory and include subarachnoid hemorrhage and stroke. Abnormal vital signs only counted if they were persistent for more than 15 minutes, and there were specific definitions of abnormal vitals for respiratory rate, O2 sat, heart rate, and blood pressure. Note that temperature is not included here. Depletion of volume included hematocrit less than 30, just as in CHESS, and also GI bleeding, either by history or hemoccult. Heart attack signs and symptoms included any possibly cardiac chest pain, as well as shortness of breath, in addition to the EKG changes expected with ACS. We won't go into the details of the other criteria here, but you can take a look at the table more on your own. So those are the Boston syncope rules. Remember, they are a bit more cumbersome than the San Francisco criteria, but bad heart can give you a head start on remembering the broad criteria, and you can reference the table if you need more details. All of the criteria represented by the word heart in the mnemonic help us directly answer our question, is it cardiac? We will talk more about the studies behind the Boston criteria in a bit. But first, let's go through a basic example. Say you have a 24-year-old female, otherwise healthy, but with an episode of syncope this morning. All of her labs and EKG are normal, and she tells you she's feeling fine now. You also learn that her father died suddenly at a young age. Based on what you know, do you admit her for further workup? Let's apply our decision rules. By the San Francisco criteria, would you admit her? No. She's otherwise healthy, normal labs and EKG. None of the criteria are met. The San Francisco rules suggest you could feel comfortable letting her go home. Now, by the Boston syncope criteria, would you admit her? Her father died suddenly, so she has a relative with sudden death. The Boston rules would suggest that you might want to admit this patient. Tune into the next episode for a look at the studies that gave us these decision rules.